The cost of chronic pain in America today. Hi, I'm Dr. Jeffrey Allen Kronk, and I'm the Director of Education for a national company called Spinal Kinetics. We're one of the #1 companies in the country in helping doctors to establish the severity and location of ligament injuries and to standardize the actual workup of a spinal ligament injury. I also happen to be the CEO and founder of the American Spinal Injury and Impairment Consultants, which is a consulting company that does educational programs for providers, educators, adjusters, the public on spinal ligament injuries. I also originated the first online training program for doctors specifically geared towards spinal ligament injuries. Look, in the United States of America in 2011, the National Institute of Health came out and said that 116 million Americans, adult Americans, suffer from chronic pain. At that time in their report, they suggested that it had an annual cost of $635 billion per year. Now, there are other reports. In 2009, the Mayday Fund, which had a call to revolutionize chronic pain in America, came out in its report and said that 20% of the U.S. adolescents suffer from chronic pain. Now, the Burden of Musculoskeletal Diseases Executive Summary Report that came out in 2010 said that in 2006, a staggering $950 billion a year costs in the U.S. were associated with musculoskeletal disorders. Now, they also said worldwide that musculoskeletal disorders affected 1.7 billion people. They said it had a greater impact on the human health than all the forces of war and nature and all of the neurological conditions combined. They also stated that 632 million people worldwide suffer from back pain, 332 million suffer from neck pain, making back and neck the #1 and #5 cause of pain and disability worldwide. Now, they also suggested that there was a problem with the funding for research to reduce the pain and suffering created by these conditions, because they found that only less than 2% of the research dollars by the National Institute of Health were geared toward musculoskeletal conditions. In 2006 and 2007, they also identified that there were 61 million episodes of treatment for musculoskeletal related injuries, and that sprains were the major problem identified, which obviously is a ligament injury. Now, regardless of the mechanism of injury, the major causes they identified for these types of injuries were sports-related injuries, playground accidents, motor vehicle crashes, civilian interpersonal violence, war injuries, stress injuries, overexertion injuries, workplace injuries, and falls. Now, regardless of the mechanism that causes the injury to the patient, if their doctor cannot get the patient to fully recover, the future healthcare costs can be staggering. So when in 2007, on the #1 cause of pain and disability in the world, which is low back pain, the American Pain Society came out with its low back pain guidelines. And they said that non-specific mechanical low back pain was the second most common reason for a visit to a doctor in the United States of America. Now, that was for a non-anatomical cause where no anatomical cause was located. So what happened was the patient went into their doctor for pain and no anatomical cause was located as identified in this report. Now, the cost yearly to manage chronic low back pain, according to the American Pain Society, is $9,000 to $19,000 per year. We see the cost to the patient can be staggering. Now, in a study that was produced in 2008, we showed that when we surveyed 20,200 U.S. adults, that the average adult who suffered any kind of significant chronic pain spent up over $12,000 per year in additional medical expenses. Again, the costs here are staggering. Now, it's been identified in many articles that the soaring costs of spending are due to specialists. They've been identified in recent research as the major cost cause for the escalated costs. Non-specific mechanical low back pain, again, is the #1 most common low back diagnosis. Non-mechanical non-specific mechanical neck pain is the number one cause or number one diagnosis for neck-related conditions. In these studies also, it was indicated that spending by physical therapists was the most costly service throughout the study period, but appeared to decrease over time. So we know there's also escalated costs there. We also know that in a 2011 Journal of Occupational and Environmental Medicine study, it was determined that patients were twice as likely to be disabled if they had care from an MD and a physical therapist as opposed to a doctor of chiropractic. So we see that there's other types of treatment statistics, and then in order to really address these costs, we have to get honest with what we're looking at regardless of the provider that provides it. So we know that in 2006, there were 61 million injury visits to medical facilities for musculoskeletal injuries. Now we know that these injuries are the major cause of back pain, which we see there was 48 million visits for that. And we also know that the injuries to the spine are a major cause of arthritis and arthritis-related conditions, which we see there were 50 million visits in 2006 for that. So not understanding traumatic spinal ligament injuries has cost our society and its citizens a fortune in unnecessary pain and disability and expense. We also know that this has led to 49% of our U.S. population now having a chronic musculoskeletal problem, with the low back and neck being the chronic offenders. Look, today families, patients, and our citizens we deserve a lot better from our medical providers, our chiropractic providers, our osteopathic providers, our physical therapists, all of our health-related providers, so that we as citizens can live very fulfilled, active, and functional lives. Today, at Spinal Kinetics and the American Spinal Injury and Impairment Consultants, we've dedicated all of our services to getting better understanding of these conditions. Today, we know that regardless of the provider type, the provider has to understand how to locate the severity and the location of common ligament injuries, especially those common to the spine, because we know the early detection of spinal ligament injuries is the key to better correction. It's the key to better cost. It's the key to better patient outcomes. And that's all we're dedicated to. For any questions regarding any of our programs, please contact us at 1-800-940-6513 or visit us at www.americansic.com. Thank you.